Well, doctors are making a plea to the city tonight. Don't visit the ER for COVID testing or minor problems. They don't have room. I talked to a doctor at St. Luke's who says hospital capacity is maxed out.
Dr. Mark Larson needs your help.
I just need the assistance of my fellow Kansas Cityans to recognize when to use that emergency department and when to use an urgent care or just to stay home and isolate.
Emergency rooms across the St. Luke's health system are packed. COVID cases and other emergencies are pushing the system to its limit, and doctors now fear patients could die waiting to be admitted.
That's my fear. That's what keeps me up at night.
There just aren't beds available here or anywhere else in the hospitals.
Historically, we always clear our waiting room every single night, and every patient has been seen, but the last several days that has not been the case.
And it's not just St. Luke's.
This is hands down the toughest surge the medical community has had to face since the pandemic began in 2020.
Doctors from all over the region report the same story at their hospitals. In Kansas, 8 people died awaiting a hospital transfer in November, but that number increased 5-fold last month.
It speaks truly to not challenging situations, but true crisis situations.
It's kind of a perfect storm right now.
With record COVID cases, the ER, he says, is right now only for true emergencies.
You don't need to get a test. If you've been exposed and you have symptoms, you just need to assume you have COVID-19 at this time.
Hospitals all across the metro are also now reporting record numbers of staff who are out sick with COVID. At the KU health system, it is 640 people. That is 5% of their workforce. Doctors say if you don't need medical care that's not an emergency, check out some telehealth options.